that there'll be lots of separate studies, and how long they take will vary. So if we do a systematic review with a group of osteopaths, that will probably take about 6 months. If we were doing more of a kind of longitudinal study, looking at patient progress over a period of 3 to 6 months, then once you start analysing the data afterwards, you're perhaps looking at more of a 12-month study. But the osteopathic involvement of that might have just been for the first 3 months, handing out information to patients to say, please take part in the study. We'd then sort of do the heavy lifting of statistical analysis and writing up research papers and disseminating it. So it will vary.
Isn't one of the challenges of this, however, that a lot of research studies compare this treatment with normal treatment? All you're going to get from this is what happens when people come to osteopaths. You won't know whether it's better or worse than what happens when they go to see a chiropractor or their GP or a physiotherapist or a sports massage therapist. How do you get that sort of data so that patients get the best treatment?
Yeah, so that would be more along the randomized controlled trial design that you're discussing, where you're comparing different arms of a trial. So you'd have a no treatment or a standard treatment versus an intervention. So that's very much an RCT. And these would be more observational studies, longitudinal studies, where we're really just following patients over a period of time. Or they might be surveys, where we're either surveying patients or surveying osteopaths. And because a lot of tools are available now, and these tools are often the patient-reported outcome measures or PROMs. They're essentially questionnaires, really, but they've been validated, which means that the questions are actually measuring something tangible and reliable that can be repeated. So often we'll use the same tools that have been used in other studies. So we actually get comparable data, and we can say, well, look, the scores in this study were favourable to the same tool used in a different study for a different intervention. So there is the ability to compare across interventions by using these validated tools. You mentioned
the term observational study there, and of course whenever I read any research, the first criticism that will come up is this is an observational study, therefore it is at the lowest end of research material. Is that your perception of observational studies, or do these new tools make it a little bit more substantial?
Yeah, there is a hierarchy. With systematic reviews sitting at the top. And so, systematic reviews are something we'd be looking at doing, and that's where you sort of bring together lots of separate research studies, whether that's lots of separate RCTs.
We've got a picture of systematic reviews, I think, haven't we? Yeah.
Lots of separate.
There it is.
Yeah, so as you can see, systematic reviews sit at the top of the hierarchy studies, and these kind of observational studies or cohort studies, the number 5, sit a little bit lower.
Yeah, so people won't be able to read this. So systematic reviews here, critically appraised topics, critically appraised individual articles, RCTs. I didn't realise RCTs would be so low down, to be honest. Then cohort studies, which includes observational studies, case control studies or reports, and then background info and expert opinion. Yes. Yeah.
So that's not to say that they don't have value just because they sit lower down in the pyramid, and that's not to say that they're not going to bring useful clinical information. And the issue with randomized controlled trials is they're conducted in a setting that is not the same as where the care is actually delivered. So immediately they lose that generalizability to osteopathic practice. Whereas if you've conducted the research in an osteopathic clinic, it's highly translatable to osteopathic practice, and you can immediately read the paper and go, yes, that's how I practice. That's going to make a difference to what I do as a clinician.